Polycystic ovarian syndrome is a really common condition that can affect up to 1 in 5 women. Essentially, it's a hormonal imbalance that means that you overproduce the male hormone testosterone, which can lead to lots of little inactive follicles around the periphery of the ovary and can mean that you don't necessarily ovulate in every cycle. It can also lead to the condition of insulin resistance, which means that it's much more difficult to control your blood sugar. It can also mean that you put weight on a lot more easily, and because there's a lot of chronic inflammation that's going on inside of the body to do with this hormonal imbalance, it can also essentially predispose you to heart disease later on in life. So what are some of the common signs and symptoms that you can look out for that might make you think you have this condition? So this is things like irregular or heavy periods, things like hirsutism or excessive hair growth in places that you really don't want to have it, like your face or your chest or your back, thinning of the hair, especially around the front of your head, oily, acne-prone skin, and weight gain, especially weight gain that's really difficult to shift. The good news is that there's so much that you can do lifestyle-wise to try and help yourself, and we're going to go through some of these points. What you eat is really important, so you want to be looking at your diet, not just in terms of helping you to reduce weight, but also in terms of being mindful what you're putting inside of your body that can potentially flare up any polycystic ovaries or chronic inflammation that's going on in there. So you want to be trying to eat food that's as natural as possible, so that's not being affected by pesticides or other chemicals or other hormones that can filter down the food chain. You also want to be cutting out refined sugars as much as possible and replacing them for complex carbohydrates, so things like sweet potatoes, brown pasta, brown rice, and brown bread. There's loads of really, really good alternatives out there. You might also want to reconsider dairy alternatives as well, but making sure that they're enriched with calcium and vitamin D, which are important. You might also wish to take some supplements, things like zinc and magnesium, evening primrose oil, and cinnamon. They can all potentially help to improve blood sugar control and help to reduce any symptoms associated with heavy periods that you might be experiencing. Exercise is another biggie. You want to try and get some exercise at least once a day for up to 20 or 30 minutes if you can. The reason this is so important is that it actually helps to preserve your body mass index within the normal range. Just by reducing your body weight by 5 to 10%, you're going to substantially increase your chance of natural ovulation. Ovulation is a particular problem with polycystic ovaries. It may not be happening for you, and therefore if you're trying to have a baby, it can become particularly difficult. So just by watching what you eat and exercising and reducing your body weight, you might significantly improve the chance of this. You also help to reduce your chance of miscarriage as well, which is super important, especially as this risk is slightly higher for women with polycystic ovarian syndrome. Stress and depression can be another thing that really affects women with this particular condition, and that's because they suffer from lots of these signs and symptoms that can make them feel really down about themselves in terms of their external appearance or inability to get pregnant. So if you are suffering from this, please make sure you go and see a psychologist or a counsellor to help you to deal with it. And finally, if none of these lifestyle tips are working for you, then it's really important to consider getting some medical help. So your doctor, your GP, might be able to start you on the oral contraceptive pill. That's if you're not trying to get pregnant, in order to try and regulate your periods if these are a problem for you. They also might try another drug called metformin that can help in terms of improving your overall blood sugar balance and might help you to reduce weight. Ultimately, if you're trying for a baby, you might need to seek the help of a specialist who can then put you on certain drugs like clomiphene or tamoxifen that could help women to conceive if they've got polycystic ovaries, or ultimately IVF. So I'd advise you to start off with some lifestyle tips first, and if they're not working, to then try some medical management and go and see your doctor who can help to do some investigations and some tests and help you to manage the overall symptoms as well as getting pregnant if that's what you're aiming to do.